concept of stroking, right, of just kind of superficial moving along through there, we're just going to take the beginning of this technique is just that same concept of kind of flat hand ironing out that tissue there. So it's a superficial stroke. So instead of doing both hands at a time, I'm going to do one at a time. Okay? And we're starting with an ironing technique, if you want to call it that. So flat hand, full, cover this joint, cover that joint type approach. Okay? Soft, full hand, just migrating through those tissues. Now I'm on the anterior lateral side, which is the tissues we've really been focusing on in this series that we've been treating. You can do this exact same thing on the medial side as well, right? Let's say they're having problems with these medial tissues. This is where you might want to start, right? So you direct your technique to whatever tissues that you find to be impaired. Okay, again, note that everything in my hand is making contact on that patient, right? Full mold, full contact, nice, easy, superficial prep, okay? Then, I'm going to keep focusing on this side since the camera angle is here, but just keep in mind it can go anywhere, okay? We're going to progress this 2 modes. So instead of being now focusing on a full flat hand, let's say we want to get to a deeper level, I'm now going to transpire most of my forces through these 2 fingers, okay? We consider this in soft tissue 2 your power fingers. Again, that's debatable which ones are stronger, but we're going to focus on the middle 2. I'm going to do the stroke. Looks exactly the same as the other one, doesn't it? Okay, but let me show you what I'm actually doing, because we want to keep full contact on our patients. This stuff does seep in very quickly. But what I'm actually doing is something like this, right? Because my power is focused on just 2 fingers, which is allowing me to get deeper and deeper. And you'll learn these concepts as you go. You learn that, broad surface contact is superficial. The smaller the surface area, the deeper it's going to allow you to go into the tissues. So that's what I'm doing, but it looks like this, because we want to keep that therapeutic touch the entire way through that process, okay? And then I can get even more specific, go for 2 finger contact, now to a 1 finger contact. And if it's 1 finger, you want to always buddy them up, right? Never go alone. Safety first. Teamwork, safety first, it's all good, right? So we're going to put 1 finger just like this, and now that allows you to actually get real deep. You can kind of slide in between the fascicles of the muscle tubes, right? So you can get in there just like that and work through those tissues. Notice that all my fingers in my hand are still making contact with the patient though, okay? It's nice and therapeutic to do it that way. And I can slide through those tissues just like that, okay? Pretty simple, right? So we start superficial broad, big hand contact, focus our pressure, right? Again, it looks the same, but my pressure is focused like this, full fingers, and then I can get even deeper by doing a little buddy up, cinch it up inside, go in between the fascicles. That feels pretty good, doesn't it, Dr. Heath?
Yes.
She's like, you got all day to stop doing that. Okay? Very simple, right? Splay of the lower leaders. That can go anywhere. All right.